Rural Uttar Pradesh, more than 500 miles southeast of New Delhi. Hospitals are scarce, and for many, healthcare is either unaffordable or places them deep into debt. Healing Fields founder Mukti Bosco is there to meet some of the 5,000 community health entrepreneurs the nonprofit has trained in communities across rural northern India over the past 2 decades. She recalls her first impressions of the area.
These are some of the poorest states of the country. We've been working in the south of India, but some of the villages that we went to, it shook us. It shook our core. The poverty levels, the living conditions kind of shook us up. So that's how Healing Fields was born, because it was kind of soul shattering.
Access to primary health care in rural India is often blocked by barriers of cost, distance, lack of education, and the dominant structures of gender and caste. Bosco realized that the emphasis of primary health care should be on prevention based around educating healthy behaviors coupled with improved access to basic care. The key to delivering this care was through women recruited from the villages. Men, she believes, were simply not suited to the task.
They don't menstruate, they don't get pregnant, they don't breastfeed. Big difference.
In India, as across the world, women are the carers, the nourishers, and often the educators. They need no incentive to improve the health of their families and communities. Healing Fields recruited and trained women from the villages, enabling them to pass fundamental health principles on to their neighbors.
वो टाइम से हमने लोगों को समझाती थी कि खाना वाना बनाने के बारे में, हाथों सफाई वफाई के बारे में बताती थी, बच्चों को हाथ धुलाना, उनको हाथ धोकर खाना खिलाना, उनको पोषण के बारे में बताती थी। बहुत मतलब हमारे ऊपर महिला जो है हमारी कहना करती हैं, हमारे गांव की जो महिला है बहुत आगे निकल चुके हैं वो लोग पहले से। पैड वैड का इस्तेमाल करने को हम सिखाई थी, अपने आसपास में लाकर भी दी थी उन लोगों को, लेकिन हमारे समझाने पर समझ लीजिए कि 80 से ऊपर सभी लोग पैड का इस्तेमाल करने लगे हैं।
हम जब से CHE बने हैं तो हमको हेल्थ के जो एजुकेशन पर हम वहाँ से स्वास्थ्य के बारे में हमको मिल रहा था ट्रेनिंग, तो हम आकर अपने घर में फिर उनको बुलाकर हम समझाए कि माने कि जा रही है। कुछ लोगों को सर बाहर जाने से किसी को कीड़ा बिच्छी भी काट दिया था, तो फिर भी हम उन लोगों को सलाह दिए कि आप लोग भी शौच को सफाई करके उसमें शौचालय कीजिए। सर हम तो एक लोगों को अपने तरफ से पैसा देकर उसका शौचालय बनवाया, जो बूढ़ी थी उनको बनवाया, वो भी बेचारी 1 साल 10। तो गांव के लोगों को हम जागरूक करते रहे कि आप लोग जो हमको शिक्षा मिला वो गांव के लोगों के ऊपर प्रभावित करते थे सर।
Working alongside her since the beginning, Gayatri Prashant credits Mukti Bosco with enabling these women to achieve dramatic transformation in their communities.
There are different ways that you can champion for women, right? You can fight for their rights, or you can work towards building them up and empowering them so that they themselves can fight for what they deserve. And that has been what Mukti has been doing.
Critical to this empowerment is the ability to earn a living. Healing Fields community health entrepreneurs sell basic health products at affordable prices, promoting good health while supporting their families.
We have built the income stream also in such a way that it is intertwined with the health aspects of our work. They don't want it for free, they don't want charity. And that was made very clear. They wanted to be treated with respect.
As the Community Health Entrepreneur Network grew, it became clear that collecting health data from remote last-mile villages would be critical to driving improved health and revealing the rising burden of non-communicable diseases, many of which can be treated with education and medicines at the community level.
We are not clinicians, okay? We are community people, we are practitioners. And the way that we talk about data is different. We don't collect data for the sake of collecting data. It has to tell us what is the change that we need to bring about and how do we solve the problem.
Never was such an approach needed more than when COVID swept across India.
COVID to us was disastrous, but at the same time, it gave us a huge opportunity and a game changer, not just to us as an organization, but to the women and the communities.
The first challenge was to provide well-resourced quarantine facilities for the migrant workers returning to their villages.
We started creating awareness, building their capacity on what is COVID, how do we prevent, how to take the precautions.
Starting from scratch, the community health entrepreneurs put the needs of others first.
पहले कंडीशन मतलब तबीयतों खराब हुई तो चट्टी चूटा पे जाए पड़ी डॉक्टर के यहाँ और मेरा दी हमने के गांव में घूमे ली बतावे ली कोनो काम लगेला तो हमनियों के कहीं नहीं जाए कोरोना भई रहे हमारा आदमी के तो पूरा मेरा दी हॉस्पिटल ना जाए देली बलिया भी गाड़ी कले नहीं रिजर्व हम लेकिन ना जाए देली बलिया कहली के यहीं रखो तेजा स्कूल पर अपन रखो के पूरा सर सफाई से मच्छरदानी खटिया कुल दूध अंडा अपन कुल भेजवावस.
One of the major challenges was to be able to deliver simple things like pulse oximeter, thermometers, masks, paracetamol, and huge banners and posters.
The solution? Recruiting local motorbike riders, providing a last-mile healthcare supply chain. But the bikers' work didn't stop there.
They had to also train the women how to use the pulse oximeter, how to use an infrared thermometer, how to wear the masks, and where to put up the posters. Now we are integrating them as part of our telehealth program so that they would be able to go to the villages and support the women in conducting health camps and in investigations and supply of medicines to the remote villages.
Like the women she has empowered, Mukti Bosco never stands still, driven by one fundamental belief.
The immense possibility of change and the women at the last mile. We have just shown a path. They are walking it on their own. And if those women can take such giant strides, I feel that it's our responsibility, God-given responsibility, that we should be able to make the lives easier.